Welcome back. Prostate cancer is the most common non-skin cancer in men. It's estimated that 1 in 8 will be diagnosed with it in their lifetime. But the good news here is it is 100% treatable if detected early. Dr. Christopher Keel and Dr. Adam Huddleston are here to talk more now about the risk factors and treatment. Thank you both for stopping by.
Thanks for having us.
I guess first, and feel free, whomever, to chime in first, but I want to talk about the importance of having these conversations.
Sure. I think it's important for men to start their journey with their primary care doctor and having a conversation about whether or not being screened is right for you. So the AUA generally recommends that you get screened between 55 and 75 with a PSA and a digital rectal exam. And it's important to talk to the primary care doctor just to see whether or not screening is correct for you based off of your age and your lifestyle and your health risk factors.
Exactly. I think there's been a lot of confusion over the years about when to screen, and so having that relationship with your primary care doctor, or seeking out a specialist like Dr. Keel, can be helpful as well if there's any confusion there.
Yeah, and so we were talking about early detection, and prevention is part of that. Once you get that diagnosis, can you talk about some of the treatments that are available now?
Well, we're fortunate now to have a lot at our fingertips in terms of management of prostate cancer, and that includes the full spectrum of observation following the PSA to surgery to radiation therapy, and we have some new even chemotherapy drugs that have come on the forefront that have been really instrumental in extending and improving long-term outcomes.
Yeah, I think one point that he made was about observation. I think most guys don't understand that that's actually an option for them, and we see a lot of guys that are reluctant to come see us for screening because they think that everything has to be treated, and sometimes it doesn't even need to be treated. So
I'm glad you brought that up, because that is an excellent point. If you could please elaborate on that for people who are watching right now.
Sure. So men with low-risk prostate cancer, and even some men with intermediate-risk prostate cancer, it's fine to watch it. As long as you're under the close eye of a urologist, it's fine to watch that, and it's safe to watch it. In the past, we've probably over-treated prostate cancer. If you look back into the 90s when PSA became available, it really started the trend for early detection. And what we've realized now is that actually observation for a large portion of our patients is actually the right thing to do.
Exactly. Prostate cancer is so common that there's a large proportion of them that will never progress and never cause an issue long term. So observation becomes a nice choice.
Yeah, we're almost out of time, but what is the one message that people watching you definitely want them to take from this interview right now?
Man up and get checked.
Yeah, don't afraid to get screened. That's really what it's about.
Yep.
All right, you heard it from the experts. Man up and get checked. Thank you, gentlemen, both for stopping by.
Thank you.
Thank you.
We'll be sure to have this interview posted for you on our YouTube channel shortly after this newscast. That way you can share the information that they talked about with someone you know.